Testing is something that particularly hits home for me because, plot twist, I had COVID. And welcome to the Butterfly Effect. If you're new here, welcome. My name is Aku and I'm the founder of the Butterfly Effect Empowerment Initiative, a media-based initiative which is focused on the enlightenment and empowerment of Nigerians and generally increasing the awareness of human rights, responsibilities and remedies that are available in Nigeria. If you're not new here, then you know that I have been doing a COVID series in which I analyze how Nigeria is responding to the pandemic. I filmed a 3-month update, a 6-month update, and now we have come to the 1-year update because today is currently the 2nd of March 2021 and the first case of the coronavirus was announced in Nigeria on the 27th of February 2020. So it's just over a year and yeah, I'm going to be sharing my thoughts with you guys. At present, the world statistics show that there are 115,172,098 cases of coronavirus in the world. There are 2,554,234 deaths and a total of 90,843,295 people have recovered. That's in the world. I'll leave the links to the statistics in the description box. But in Nigeria, the NCDC is reporting that there is a total of 156,017 confirmed cases. 19,613 of those cases are still active, whereas discharged cases are 134,489. But it's also being reported 1,915 people have died. So as I was saying in the last video, so far, we know that the coronavirus is not a death sentence. Once you get it, it's not impossible to recover. And in fact, there are more recoveries than there are deaths. I think the whole panic and initial, like, oh my God, what's going to happen, was just at the beginning when it was still like a new virus and nobody really knew what was going to happen or, you know, how our immune systems were going to respond to the virus. But so far, you know, we've seen that COVID is not the end. The world is moving on and things are going back to normal, essentially. The new normal. This is the new normal. I've heard some people equate COVID to like having a flu. So, you know, it's strange like that. But anyways, in the last video, I had broken down the analysis into 3 categories, and that's communication, testing, and finances. And I want to still follow that, you know, line. In the last video, I was complaining about how we haven't heard from the president. We still haven't heard from the president. Even how he responded during the NSAS violations just showed me that, okay, you know what, the guy is generally lax. Even when you've killed a bunch of your citizens, you know, innocent blood has been shed on the line. You came out like 3 days or 4 days after to come and talk to us. So why is it a pandemic that we didn't even see blood on the floor in front of us that you feel pressed to talk about? Communication is still lacking. Different states are still doing their own different things. So that is one thing that is for sure. When it comes to testing, now testing is something that particularly hits home for me because, plot twist, I had COVID. If you don't know, I have a second channel, a vlog channel in which I share, you know, my own personal like journey. So I had documented my journey with COVID. So please do go and check that out. But I was asymptomatic. I only ended up testing because my dad had it. And my dad had it quite bad as well. It was after Christmas, you know, like I said, you know, different states were doing different things. Because from when I last spoke to you about COVID, the next big thing to happen was NSARS, and when NSARS happened, it just kind of threw everything up in the air. They reintroduced curfews, you know, they reintroduced stricter policies on social distancing, things like that, because they were trying to prevent people from gathering again and protesting and, you know, starting a whole new revolution, if I'll call it that. NSARS also revealed to us the palliative pandemic that was happening. Now there's a joke of, are you going to be like palliative? Because during the NSAS protests, you know, people were wilding out, a lot was happening, and people now ended up discovering palliatives that had been stored in warehouses that had gotten so rotten. Like you see Gary that's molding, Indomie, you know, different palliatives that were meant to have been given out were being stored in warehouses.
what is happening in my area.
Your area is where? Monkey Village.
I'm standing in my house now. This is Monkey Village. It's happening live and direct.
Monkey Village.
All the palliative that they brought during COVID-19, during the lockdown, they kept it in warehouse. The government have been coming with the van vehicle to come and carry the goods, the palliative. So they did not share it. Now the youth went and break the warehouse and they are carrying the palliative. Look at it. See people the way they were keeping.
And it just once again showed the lapses in our government, in our society, in just how we're doing things over here. So when that whole drama happened, shortly after that, that was around October, the killings happened on the 20th of October 2020. And then from there, it was just a dwindling effect. Everything just started going downhill. So we realized the palliatives, and then they reintroduced stricter policies on curfew and things like that again. So that happened, then December happened, and why I say different states were doing different things was because during December I was in my own home state, which is River State, and you know, there was still a lot of social events, weddings, burials, you know, you name it. Christmas was late in River State, whereas I heard in Lagos they were still not allowing clubs open, things like that. So you know, I think different people had their different policies during December, but then during December there was definitely, forget social distancing, was that everybody was like, ooh, we've missed being out, so let's do it again. So that happened, and then you know, I did all of that, came back, spent Christmas in River State, had my enjoyment with my family, was going for different events. Then I came back to Lagos in January, and then I heard, oh, my dad has fallen ill, my dad has COVID, my dad has to be checked into an isolation ward, and you're like, whoa, what's going on here? So you know, it became realer for me, and I saw where it is dangerous, because my dad is diabetic, so you know, he was a high risk case, his oxygen levels were low, things like that, whereas me, I didn't even know I had it until I went to get a test just because he had it, and it turned out I got a positive result. 10 days later I tested and I got a negative result. I tested it again a week ago, I got a negative result. I just told myself, you know what, I'm going to be testing. And I also share my struggles with testing, because in my previous analysis videos, I was talking from the outside, like it wasn't a personal thing to me, but now I've personally experienced it, and I share so much on my vlog, so you'll see the frustration I have with testing. The most credible test to do is private test, the PCR test, and it costs over 50,000 naira. Who is going to be paying 50,000 naira a month when you don't have any symptoms, or when you may not even have the virus, or when you can just self-isolate for 14 days? And when I actually realized how strenuous it is to test, I even went to the free testing center in Yaba, and they turned me back because I didn't have any symptoms. They're like, they don't test if you don't have any symptoms. A few people commented on that video saying that that's also how it's done in the UK under the NHS. Testing is limited, they don't want to waste it on just anybody, so you need to have symptoms before you test. So it now makes sense to me why on the NCDC website it says only 1,544,008 samples have been collected in a country of over 200 million. So it's like, oh, really and truly, these numbers are not accurate at all, because we're not even, like, testing is so inaccessible. And I can't imagine, like, because obviously me, when I found out I had to call my trainer, I had to call like my cleaner, the different people I had been in contact with, to let them know that they needed to test as well. And the truth is, none of them tested. They just waited for 14 days and went back to their normal lives, because they were like, they don't know where to test, number one. They don't even know how they're going to start bringing. I mean, I was not about to pay 50K. Like, so testing is just so inaccessible for a lot of people, and it makes you just know that figures are not accurate. Treatments, when I had it, you would also, please just watch my vlog, because I don't want to spend too long talking about my own personal you know, experience. But I had it, I called NCDC. There was so much bureaucracy, because they're like, oh, call the lab. They'll tell you, call this person, call that person, call the lab. It's your lab that will tell you what to do. I'm like, but are you not NCDC? Is it not you that should tell me at least my treatment plan or something? They're like, no, if I call the lab and the lab doesn't answer me, then I should call them back. Like, and even when you go to the private lab, when you're filling in your form at the private lab, there's also a link it takes you to online, a Google form, which is like an NCDC form anyway. So it's like even the NCDC is reliant on the private labs, and it's just a hot mess over here. So those of us that have had it, and have been able to survive it, we just must thank God, because the government is not the one helping us, it's private efforts. Okay, and then moving on to the finances, there's still so much mismanagement of funds, as I had shared in the last video. Not only did that thing happen with the NDDC, now also have this issue with the palliatives. I'm just seeing how governments, apparently you could see in Sanwo-Olu, that's the Lagos State governor, there were packets of rice, COVID rice, in his mom's house, and it's just like, why? Like, you can afford to buy your mom rice, you don't have to take the one that's meant to be palliative. So we still haven't gotten any kind of report on the private donations that were made. As I mentioned, it's I know the only people I feel like, you know, were clear about what they were doing were private organizations, and even the government policies are also not even like, I don't even think they are even considering the true situation of things on ground, because it was during December that they all of a sudden restarted the whole NIN, that's the National Identity Number registration policy. And I went for that, and I'm like, there's so much crowding here. You're bringing so many people together during a pandemic when we're apparently meant to be social distancing. For what? Like, why is it now all of a sudden that you want to start registering people, and why can you not do at least a major portion of this thing online? A lot of people still believe that COVID was a money-making scheme. If not that I had tested positive for it, if not that I had actually seen my parents have it, I would have still been talking about it like as if, you know, it's just this makeshift disease, really and truly, because like not much has changed. Like, even our healthcare systems, there's no improvement. Even flying, the other day I was vlogging my flight. Please check out my vlog channel, because you'll see a lot more behind the scenes. But the other day I was vlogging my flight from Lagos to Abuja and Abuja to Lagos, and I'm realizing that people are even flying without masks now. Like, you know, you're on the streets, the general streets of Lagos, those that are wearing masks are like unicorns, like they stand out. Those of us who wear masks is really even only when you're going into a shop or a restaurant. Once you walk in, once you pass security, you can move it to, nobody tells you anything. But you know, I feel like the culture is still just like, we keep it moving. Like, I don't know how to explain it. Like, it's still not a deep thing. Whereas I hear that in England, there's like tier 2, tier 3, tier 4. There are like so many. I feel like, you know, it's more of a pressing matter there, and they're experiencing more deaths. But I believe that they're only experiencing more deaths, and their statistics look more grave because their statistics are more accurate than it is over here. I'm sure so many more people have died that haven't disclosed that they have the thing and all, you know. Even when my dad got it, we now, like, in the truth now started coming up about so many notable Rivers men who had also had it, and it's like, you people had it and nobody said anything. Why? Like, people are having it and keeping it to themselves. Me, personally, I know so many people that have gotten it now. But anyways, I say all of this to say that things are still in shambles. What's now next on the agenda is vaccination. So many people are getting vaccinated, and it's reported that today, actually, almost 4 million of the Oxford vaccine has arrived in Nigeria, and it will be interesting to see how it is rolled out and, you know, how people generally respond to it. Personally, I don't know if I'm going to take any vaccine in Nigeria. I don't know if you guys have started taking your vaccines abroad. Please, you know, share in the comment section. How is it going? Like, what's the difference like for you? Are you noticing that, you know, there are welfare options for you? The healthcare system is improving. Like, did COVID actually make a difference? Like, 1 year later, would you say that COVID made a difference to your society, to how, you know, your country is running? In Nigeria, I wouldn't say it made any difference. I would say it only even exposed further the lapses in our government and, you know, how our society is being run here. Like, why should our government be storing palliatives for themselves? Like, it just shows you the greed that this country is running on. But yeah, so I didn't want to make this video too long. Just wanted to come and share, you know, a 1 year update, and I'll be providing another update, I guess maybe like at the 18-month mark. So we'll see how that goes. Thank you so much for watching. Please be sure to like this video, share it, subscribe, contribute in the comment section below. And last but not least, don't forget that one small change can result in great transformation. See you.
But we keep waiting on the world to change. We keep on